Good afternoon. Welcome to the press conference for the Johnson County Emergency Operations Center for Wednesday, March 25th. My name is Kelly Andreessen. I'm the Public Information Officer for Johnson County. Thank you for those in the media reporting on this and to our community partners who are participating and for all of you who are tuning in live. Again, this is a rapidly changing situation, so we do appreciate your patience and flexibility in doing things a little differently these days. And we do hope to move to a more virtual platform for future press conferences, and we will keep you updated on that once we get those things arranged. Just a few reminders: we're working with American Sign Language interpreters for this press conference. So for those reporters, please make sure that you're including them in your shot. We are streaming this live on Facebook on the Johnson County Public Health page. We do have a microphone for the reporters. So if you do have a question, please raise your hand, state your name, ask your question so that those who are tuning in remotely can hear. And when you raise your hand, Krista will pass off the mic. We are practicing social distancing, so we've limited the number of people in the room to less than 10. For those purposes, I will bring in each speaker one at a time. They will make their statement, and then we'll open it up for questions for that person. So for the reporters, if you do have follow-up questions with an individual that you didn't get to during the press conference, just please touch base with me after, and I can get you connected. Like I said, this is a rapidly changing situation, and all of our community partners are sharing the information that they have at this time, so we do appreciate your patience, flexibility, and understanding. So we will get started with Dave Coach, Director of Johnson County Public Health.
Thank you, Kelly. And again, welcome everybody. Johnson County Public Health continues to work with the Iowa Department of Public Health and a number of local agencies to contain the spread of COVID-19 in our community. Currently, there are 43 positive cases in Johnson County. 9 have recovered from COVID-19 and are no longer considered infectious and are now under the same recommendations as the general public. We are fortunate to have great partnerships in our healthcare institutions, both here in Johnson County and in Linn County, along with the Iowa Department of Public Health and the emergency management, again, here in Johnson County, as well as Linn County Public Health. The governor's closure of restaurants, bars, gyms, salons, and other public places, along with additional government and private sector businesses voluntarily closing to the public or having their employees work from home, and the schools and colleges closing, will help us to stop the spread of this virus. COVID-19 is in Iowa communities, and many more Iowans are likely to become ill in the coming weeks. We must practice social distancing. Social distancing is putting space between yourself and other people. Maintain a distance of 6 feet and avoid gatherings. Cover your cough, clean your hands, don't touch your face, contain yourself at home when sick. All of these messages that we've been talking about. Clean and disinfect frequently touched surfaces. Though we encourage people to stay home as much as possible, remember that social distancing must be practiced everywhere. If you must go out to the grocery store or pharmacy, maintain the 6 feet and wash your hands. The goal of social distancing is to lower the space and extent of the spread of COVID-19. If that can happen, then there will be less people with the disease and less people needing healthcare interventions. The actions every single person takes right now will directly affect the ability of our healthcare systems to care for the ill. Staying home on your couch or going on a walk away with your children, away from others, is actually saving lives. It is. It truly is. Now is not the time to shop for non-essential items or hang out with friends or extended family. All we have is social distancing to slow this. These sacrifices of missed sporting events and dining out with friends will be considered small if we can keep those older adults and those who are immunocompromised from getting sick. This won't be forever. The majority of us that will not get extremely ill from this virus need to take actions now to keep the most at-risk safe. Thank you to all of Johnson County residents who are making big and small sacrifices in their daily lives to stop the spread of this virus. So at this point, I'd be willing to open it up for questions. And yes?
Hillary from the Press Citizen. Is Johnson County could implement its own shelter-in-place or stay-at-home order, correct?
Correct.
Okay. What are the idea right now is that we have more people infected than there are tests available to get confirmed cases, correct?
We don't know that for sure.
Okay. Experts are saying there are way more people that are infected generally across the country
Sure.
than we do have tests available. So how are we deciding something like a shelter-in-place order locally if the tests that we have we're assuming aren't accurately showing the extent of spread?
So one thing to remember that'll answer part of this question is that we're told that at least 80% of the people that have the infection will not need a test. And so again, we're reminding individuals to stay home when they're sick, to call their healthcare provider rather than showing up, to be assessed remotely before they might show up at the hospital. There are more tests coming on all the time, and there's really very little restrictions for healthcare providers to be able to issue and call for those tests. We've got other healthcare professionals that will be speaking today that can answer that question perhaps more directly.
Michaela from the Gazette. I had a follow-up to that, Dave. You said at least 80% of people will not need a test. So is that to help conserve supplies, or is are officials not worried about trying to get an accurate count of what the spread is community-wide?
And I should back up. Maybe I need to clarify that. At least 80% of the individuals will have mild symptoms and likely would not need a test. I think there's still benefits in collecting as much data as we can from these tests, just because it is a novel virus, to be able to learn as much as we can about that. And again, the medical professional speaking today can answer kind of the importance of having that data to be able to study this moving forward.
Mitch Fick from Iowa's News Now. Is there a numerical level that would need to be hit in terms of confirmed cases or testing to have the county have a shelter-in-place order on their own, or is it something that you collaborate with the state with and they give the order?
That's an excellent question, and there's since last Saturday, I can't tell you how many conversations we've had both locally with the state and with Lynn County to be able to make that determination. So there's really a lot of things already in place that I read through and that we're doing locally. Some are orders from the state. As I said, all of the schools, the colleges, universities, what they've done, a lot of the businesses that have closed their doors and working remotely. So all of those things are strategies to slow this spread. To answer your question, though, specifically, there are metrics that you heard the governor talk about yesterday that have been developed. And I think it's important that every county kind of look at their own specific demographics, because there is a large difference, even within Iowa, from county to county, regarding those demographics, regarding the healthcare structure. And all of these things need to be taken into account. So it's really difficult to be able to say, these are the metrics, these are the thresholds that would be used across the state. I think, Iowa Department of Public Health is allowing that latitude to consult with them locally, whether that's a local shelter in place or if that's statewide. Those are all conversations that we're having. Yes.
Hillary from the Press Citizen. So what are the concerns about issuing a local shelter-in-place order in Johnson County that would be, that's it, actually.
Sure.
I'll just leave it at that.
No, that's an excellent question. And there's certain aspects, both from economics, that elected officials are also considering. There's aspects from the medical and healthcare institution. And again, Dr. Brooks Jackson, would be able to speak to some of those points from a healthcare facility. I know there's a lot of concerns with the supply chain, with workforce, and those types of things, and he can speak to that.
Travis from KWWL. When you guys are notified that there is a positive case in the county, what is your department's role in that? As in, is there any kind of like in-person follow-up or something like that? And kind of an avenue of my question is, what are you guys doing to make sure that your staff stay safe during the process?
It's an excellent question, Travis. And just yesterday, our disease prevention specialists have the role of doing the surveillance, and there is no physical contact. First of all, I'll make that very clear. It's all through the phone. What they are going to do, though, is develop a short video or a PowerPoint that will really educate the community of what their specific role is and what those steps are for that investigation and for that surveillance work, so that the community better understands our role from that perspective. And like I said, we just talked about that and thought that that would be a great educational piece for the community to understand that.
I think I heard from your department maybe like 3 weeks ago that what you guys do is like you talk to someone who's, you know, either a confirmed case or showing symptoms like twice a day, check their temperature over the phone or over Skype or something like that. As you know, as we get more confirmed cases in the county, are you stretched so thin that it becomes like, well, this person's not that sick, so we only check in on them once a day? Or do you have enough to do the protocol with every confirmed case?
So we will continue to do the operations as we're doing right now, and we've got additional capacity. So we're bringing on other Johnson County Public Health staff that typically are not doing that role of investigation and surveillance. Since all of their operations are scaled back, we have the capacity and resources internally to train those individuals. We just had that conversation at our incident command meeting this week, and those individuals are being trained so that we can continue to do all that monitoring that we need to. There potentially could become a point that it is such a large number of individuals that the state would say, okay, at this point we're not going to do that tracing. I think King County in Seattle has reached that point. And so we will continue to do everything that we're doing now until we are told differently from the Iowa Department of Public Health.
Can you just specify and clarify exactly what those points of contact are, just so we all have it correct, and what like the daily check-in schedule is with a patient?
So you mean from our staff to the patient?
Correct.
So that would be what I just talked about as far as that process of surveillance and checking in will be really honed in every step. So I just want to wait until that is developed and shared with everybody so that that message is accurate and consistent.
Going back to the metrics for a shelter-in-place order, I'm wondering if you can share what Johnson County specifically, if you could share what metrics you guys are, like a threshold, if so many hospitalizations or rate of infection for Johnson County specifically, where you would go that route of declaring a local shelter-in-place order?
So I can't answer that specifically, but I can tell you that you said just for Johnson County. We will work in concert with Lynn County. So if one county orders a shelter in place, it would be in step with the other county, just because of the nature of the corridor and the commute between the two communities. It just needs to be consistent between our two counties. Those metrics, as I stated earlier, are still being discussed. So we've got a few more questions for Iowa Department of Public Health on those metrics and the values and the thresholds before we're able to really utilize that tool. And again, that is just one tool to help us determine. We're also looking at many other factors. And so all of those, like I said, the factors from healthcare, the factors from businesses and the economy, certainly from public health, are all taken into consideration. All right, thank you very much.
Now we have Brooks Jackson, a physician and dean of the University of Iowa Carver College of Medicine and vice president for medical affairs for UIHC. Dr. Jackson has 30 years of experience in viral diagnostics, viral vaccine and drug trials, and viral epidemics as Vice President of Health Sciences and Public Health Officer for the University of Minnesota. He also previously served as Chair of Pathology and a faculty member in Johns Hopkins School of Medicine and School of Public Health.
Thank you very much. I'd like to make a few introductory remarks and then would be glad to take your questions. I think, obviously, listening to the questions to the speaker before me, the issue about stay in place or order shelter in place is clearly one of the big issues. Obviously, we have now, I think, 145 cases in Iowa, which is less than many other states and maybe a little earlier in the epidemic, but still a major cause for concern. And of course, we do want to flatten that curve in order to successfully manage the epidemic, as well as minimize the number of hospitalizations and deaths. And, you know, there are reasons to believe that we may be able to do this without an order to stay in place for several reasons. And for one thing, the demographics of every state or county can be quite different. For example, Johnson County, the average age of citizens in Johnson County is 30 years of age compared to the nation, which is 38 years of age. Obviously, you're at higher risk for hospitalization and death if you're older. Also, we have a highly educated population and a much healthier population overall in many ways, less smoking, for example. The density is 120 times less per acre than New York City, for example. We don't have mass transit, which these vehicles can serve very well for transmission, as well as, you know, very large apartment buildings with thousands of people in them that may have shared ventilation systems. They're almost like cruise ships. So we don't typically have that so much in Iowa or in Johnson County. The other thing is, the governor and the IDPH, relatively early did put in measures, as David before me was mentioning about, limiting gatherings to 10, to closing schools, restaurants, bars being closed, salons, that sort of thing. The university itself, as you know, has gone to virtual online, so there are literally like 30,000 less students in dorms on campus or being on campus every day. So that clearly it has helped. Emphasizing the social distancing of being 6 feet apart and hand washing clearly is critical to helping stop transmission. And other countries such as Japan, which is highly dense and a much older population, has done this pretty successfully without going to a shelter-in-place sort of strategy. So could we do it here? And I think, this is certainly worth considering without having to do a shelter-in-place. I think some other things that we in Johnson County are really trying to do is mentioning about monitoring patients who are COVID-19 positive, so that if they do start getting sick, we catch them early before they deteriorate with their health too much. And I think we are putting in systems in place to do just that, to minimize then hospitalizations and ultimately minimize deaths. We're very fortunate at UIHC to have a really world-class facility with some of the top pulmonologists and intensivists in the world, and we have access to new drug treatments such as remdesivir, and we're starting convalescent plasma protocols. So these are things which we also hope will minimize morbidity and mortality in Johnson County and to patients who come from elsewhere in Iowa. One of our concerns about putting an order to stay in place is, one, it's economically very disruptive, and we do worry about it impairing our supply chain, which is already under stress as it is. It also, and so to give you some examples, we're a very large organizations with I think a 17,000 person head count, and probably a couple thousand are close to working from home. But we need people at the hospital and these clinics, and they come from all over. They not just Johnson County, but surrounding counties as well, that are traveling in every 24/7 there. And we also depend on thousands of other people that are not UIHC employees, but they provide services. These are small business owners, for example, that potentially provide services. And so if order to stay in place and they lose most of their business, we lose their business too, and ability to provide services for our system. It also disproportionately adversely affects low-wage earners and the small business owners, as I said, and minorities in particular. So there are some real downsides to them, and you do worry that stay in place, especially among older individuals who may be sick, may be hesitant to go out because of this order is in place, how that might be interpreted. So there are some potential downsides as well. Nevertheless, I think if things like hospitalization rates, death rates, the number of cases per so many 100,000 population, these are metrics that I think need to be looked at, as well as our capacity to take patients, staff beds, are all being looked at with the IDPH. That would at some point might trigger a stay in place. So I don't think we should rule it out. But I think in the meantime, it's extremely important that community leaders and the press stress the importance of minimizing contact with others, especially for people over 70 and others with underlying diseases such as high blood pressure, diabetes, heart disease, as they are at significant risk for hospitalization and death with this particular infection. And likewise, younger, healthier people should, really do need to keep 6 feet apart and wash hands to limit the spread and to stay away from the most vulnerable among us in populations. And I think if we can continually send that message, which we have started already, we may be able to mitigate the curve here without resorting to a pretty drastic step of shelter in place. So with that, I'll be glad to take questions.
Mitch Fick from Iowa News Now. UIHC now has in-house testing for COVID-19, but it's said to be limited. If you could just expand on that, the limitations of those tests. Yeah,
we do have it. We started it last Friday, and it is gearing up every day. We are operating three shifts to provide testing. We are, for the most part, following the criteria that IDPH has said, although we will, make exceptions. We believe we can probably triple or quadruple that testing probably in a week or so. The FDA has approved some commercial assays that are very quick, that we're waiting for reagents, and got our orders in. Should we get those this week, which we hope, I think this will allow us to greatly expand the testing as well. But we do have a clinic called the influenza-like illness clinic, that if you have cough, fever, we will test you. You come to the clinic, we will test you.
Okay, we have a remote question here from Ryan Foley of the Associated Press. Johnson County continues to lead the state in the number of positive cases by a lot. What is driving that beyond those that were on the cruise ship in Egypt?
Well, I'm not sure I'd agree with a lot. I mean, if you take out the 15 or so on the cruise ship, I think we have 43, which would put us to, about 28 or so. As a percentage of the cases in the state, it is going down. So the direction is we are becoming less and less. But I think also we are Johnson County is one of the more populous counties in the state. I mean, Polk County is obviously the biggest. And it wouldn't surprise me if the number of cases in Polk County, just because of its density population, will start, catching up. Obviously, we have a lot of travelers that come into Johnson County because of our university and faculty and things like that as well. Probably, to some extent, may contribute to that.
I'm just wondering, so the New York governor set an amount of beds that that New York was going to need in case of a surge of patients. I was wondering if UIHC had any numbers of the number of beds that UIHC is going to need. That's
So we are finalizing our surge plan this week. We have different levels that we are looking at. I don't want to give numbers right now, but I think we have significant bed capacity. I think the bigger challenge is probably staffing, especially if for the more intensive type patients that might be a limitation. But right now, we can handle the number of patients certainly in the next week, I think. So.
Hi, I was hoping you could follow up on how staffing will be a challenge. Is the university looking at any ways to try to increase staffing capacity? I know New York pushed up graduation for its fourth-year medical students to get more interns. Is the university looking at anything like that?
Well, we do have, we have 450 medical students who have finished their clinical clerkships. They're on a voluntary basis right now to help out. So we are, and they are stepping up, a number of them, to help out with that. The issue will be medical care, especially in patients who are very, very sick, require specialists. And there are only so many pulmonologists, there are only so many intensivists, so many respiratory therapists. So, this is where you start. You can't, it's not so easy to interchange, a pathologist for an intensivist or a psychiatrist for an intensivist, for example. So that's what we're really looking at right now. Where are those specialty areas we need to draw from, should we need to? Like I said, right now we're fine, but it's one of our challenges, like everywhere, is still the personal protective equipment, which we are making progress on, but it's still because we use so much of it now. We use much more of it for all sorts of patients that we didn't so much use to before to really protect our workforce.
Hillary Ojeda from the Press Citizen. The university just purchased a 3D printer, and I was just wondering if that can be used for any kind of printing of, for example, protective equipment or any other equipment that's being
Yes,
used
we are definitely looking at that. The community, not just within the university but outside, has been extremely helpful in being able to provide PPE or make PPE. And so, for example, we have really resorted now to using much more face shields, whether you can go down to your local construction, the contractors go to get the grinder face shields and things like that we never used before. So we're finding all sorts of innovative ways to increase our PPE. As I said, some people are manufacturing. They're going down to Lowe's or whatever and buying various acrylic to make that, or plexiglass, for example, for our screeners, things like that. So we are not just depending on the outside to do this. We are doing it on our own, a lot of it, which is great. Iowans are, when they see what there can do people here. So I think we're making progress there.
Sorry, I didn't hear if you answered the question about using the 3D printer that the university got.
Yes.
Okay.
Yeah.
So yes.
Yes.
Could you say what it's being used for?
So at this point, some of it is for the types of acrylic shields, potentially, this sort of thing. There's another thing we're using it for, and it's escaping me right now, but I know there's one other thing, and I can get back to you to give that to you for your article if you want.
Not respirators or maybe respirators?
That's possible. I don't know offhand.
Thanks.
So we have another remote question here from Kate Payne with Iowa Public Radio. She asked, based on disease modeling, what is the estimated range of COVID-19 cases that we can expect here in Johnson County, and when is the peak influx of patients needing to be hospitalized expected?
Well, every country and community is different. I will say, if you look at all these different countries, even the ones that have the most cases, at least where we've tested and know about the case, it's not more than 1% of the population, for example. So Johnson County has 149,000 people, so it would be unlikely we'd get more than 1,500 cases here. That would probably be the extreme, I think. And most of those would not need to be hospitalized. So what is the trend? As you've seen across the world, it can vary considerably from being very slow rising and then all of a sudden jump to just keep slowing and plateau. So it's a new virus, and it's really hard to know. And as I said, the demographics and of each community is quite different, and the factors that affect that. So,
speaking of the demographics, the average age of someone in Johnson County, 30 years old, you said, is that based off of the student population also?
I don't know offhand. If you look up though the demo, if you just Google Johnson County and it gives you all the different demographic factors, it says it's 30 years of age.
Okay, thanks.
Hi, Michaela from the Gazette. I apologize, I didn't introduce myself earlier. Kind of jumping on that previous answer to the question, for those directives to stay at home, social distancing, how long do you think we need to be doing those kind of practices? I don't think there's necessarily been an end date to those, but I wonder if you have a sense of how long this may be going on for.
Well, with what we're doing now, clearly, as I said, it might trigger a more drastic step, but clearly we would like to see when you start seeing a plateau and new cases going down would clearly be an issue. I don't think any country at this point has decided. I mean, China, which was the first, the Hubei province and Wuhan, they've had no new cases in the last 6 or 7 days, but they still they're not opening up that province until I think it was April 12th or something like that. So it's hard to know at this point, but clearly you'd like to see no new or very few new cases on that. Obviously, as more and more people get infected, whether they may be asymptomatic or mildly symptomatic, you do start building immunity in the community, and that herd immunity will be protective ultimately.
President Trump has said that he wants the country to be open by Easter potentially, and I'm wondering, just as a health official, if you would recommend elected officials to maybe not do that, or go against what something like a directive from higher up.
Well, we'd certainly like to be able to do that by Easter. Given the trajectory we're seeing in a number of states at this point, unless something changes, I think that will be unlikely. But, it's possible, but I think it's unlikely. We all wish for that, that's for sure.
Travis with KWWL. Just given that the situation is always changing, can you say right now how many patients may currently be being treated for COVID-19 at the University of Iowa hospitals and clinics?
Well, I think, roughly about 40 or so. Not all of them are from Johnson County, but about that. They're not inpatients, but total.
Being at the least advised by your doctors?
Yes.
That's what you're saying?
Yes. I mean, there's also Iowa Mercy City, and you'll talk to Sean Williams too. They're seeing patients as well.
So that number you just said, that's for all the hospitals in the area, or that's just for the university hospitals?
These are people that we have tested that have been positive. Most of those we are following up, but they could be going to other providers.
Can you say how many are inpatient right now at UIHC?
Yes, we have, I think, 5 today.
Thank you.
Mm-hmm. And I should say, they're not all in intensive care either. Okay, thank you.
And now we have Sean Williams, President and CEO of Mercy Iowa City.
Good afternoon. We at Mercy Iowa City have been meeting regularly with our mayors and city managers of all the communities in and around Johnson County. This has given us the opportunity to share with one another how best to manage this situation, our best practices, as well as our recommendations. As a result, Mercy Iowa City does not support a shelter in place that's being contemplated. We believe this would disrupt not only our supply chain and our staffing, but also would create anxiety, in some cases panic, and we would expect a number of healthy individuals that would be coming in for testing, utilizing equipment, testing procedures, PPE equipment that we want to conserve for the predicted surge that we're all preparing for. We encourage folks to follow the CDC guidelines, social distancing, washing your hands, staying home if you're ill, and with a particular focus on those that have an underlying health concern, or as Dr. Jackson mentioned, are over the age of 70. Our Mercy clinics began offering telehealth appointments this week. We've also stood up an ILI clinic, influenza-like illness clinic. We are waiting on some final approvals, and we'll have more information on that in the coming days. PPE and personal protective equipment remains in short supply. We have begun receiving donations through Johnson County Emergency Management, as well as from the community, and we are enormously grateful. In addition, a group of our colleagues began making face shields this week, and as of yesterday have completed more than 700. There's more information regarding this effort on mercyiowacity.org on our COVID-19 page. We've expanded our capacity to care for patients who test positive for COVID-19 and need an inpatient stay. We've converted our largest hospital unit for this purpose. It is a negative flow unit with a dedicated air handler. This would allow us to treat 28 patients in private rooms, but we can ramp up to 50 or 55 inpatients with each room having 2 beds if necessary. We currently have 4 patients that are housed in this unit. We've begun working with a reference lab for additional expedited testing as well as in-house testing, but it is a reminder for everyone that you still need a medical order in order to receive a test. So individuals should call their doctor. If they do not have a provider, they can call Mercy on Call at 319-358-2767 to be screened before a test can be ordered. Mercy has been a leader in responding to the COVID-19 pandemic, and we encourage everyone to follow all the recommendations to prevent the spread of COVID-19, but above all, to remain calm and have confidence that we're here for you and that together we absolutely will get through this. With that, I'd be glad to take questions.
Hillary Ojeda from the Press Citizen. Could you talk about the condition of those 4 patients?
So there's 4 patients that are in the unit. There are 2 that are COVID-19 positive. We have several patients that we're monitoring and waiting on testing.
Could you talk a little bit more about the new influenza-like clinic And who would be going there, who would be treated there, what kind of treatment they would be getting, how many people would fit there?
Sure. Anyone that had, again, influenza-like illness, any kind of a respiratory illness, will be able to go there for care. We will have drive-through options for some of that care for individuals that we're kind of finalizing right now. And they'll also be able to be seen or advised and followed up with telemedicine, and they'll be explained to them at the time. And we should have more to announce on that, we hope, later today.
Hi, Sarah Watson with the Daily Iowan. I'm wondering if you have an estimate of how many beds that you'll need for an expected surge.
Yeah, so if you look at the total number of cases in the country, and then you look at the total hospitalization rate, it looks at this point, and again, it's a very fluid situation, to be about 8% of the positive cases. As you heard Dr. Jackson mentioned, if you look at our population in Iowa, or in our case in Johnson County, if you figure based on previous experience around the world that 1% of that population becomes infected, you could take 8% of that. I haven't done the math. But it's some of the numbers that we're projecting. There are lots of different models for analyzing this that are out there. I don't know that there's one that you can put full faith in. So I think we're looking at lots of different modeling that's being done and trying to understand the assumptions that went into that. Obviously, we want to be prepared for the worst case scenario. But I think at this point, when we look at the numbers, we look at how it's spread, the fact that Iowa and certainly Johnson County is not nearly as compact from a population density perspective, as well as mass transportation, housing, et cetera, that we feel that it is going to be a different scenario in Iowa than what you would see in other more densely populated areas. But it's something we're looking at literally multiple times a day.
A follow-up.
Yeah.
This is on a separate topic, but you had said that that Mercy was not recommending a shelter-in-place order. It was not in favor of that.
Correct.
I'm wondering why there's a difference between Lynn County hospitals and like Mercy.
Sure. I can't speak for Lynn County. I can tell you for us, the number one challenge we face right now that we're concerned about is supply chain and the ability to staff our organization from the emergency department to the outpatient clinics to the inpatient side. There's also, I think, conflicting opinions from experts as to how effective a shelter-in-place model would be, number one, in effectively being implemented, and two, in slowing the spread of disease. But what we do know is that it will have a dramatic impact, we believe, on our supply chain, which is both local, regional, statewide, national, and in some cases international. So anything that disrupts that for us, especially now, is of major concern. The other is staffing. There's unintended consequences that will come along with a shelter-in-place model that could severely impact our staffing. The number of physicians, as you heard Dr. Jackson mention, that can provide the care that's needed is very limited. And if they or their family are severely impacted by a shelter-in-place, it could disrupt our ability or their ability to be there for us and to provide care for our patients. So there's also the notion that given some of those facts, if anything that increases the anxiety or that causes folks to feel more panicked about the situation, should be avoided. And I think us as leaders, we've talked about repeatedly in our meetings with the mayors, with the city managers, with other healthcare leaders, need to make sure that we're sending that message that for most people that have a COVID-19 diagnosis, 80% of them, it's a mild respiratory illness, according to the CDC. Only a small percent would need to be hospitalized or would even need to go to the emergency room. And so I think for the general population, we should be focused on those that are most vulnerable, either because of age or other underlying conditions. And they should absolutely, and those that care for them, should absolutely be taking every precaution. But I think across the board, shelter in place would create many unintended consequences that would hamper our ability to consistently provide care.
Hi, Michaela from the Gazette. The university said that they're looking at the empty university dorm space as potential staff housing. I didn't know if Mercy was looking at similar measures, if you were also inquiring about the use of dorms for your staff.
No, we have not inquired about dorms at all for our staff.
Travis from KWWL. Have you had any problems with people showing symptoms coming to the hospital unannounced? Because I know that was something that we thought would maybe happen that you guys would try to avoid. Has that happened?
Some of the early patients that came in, some of the first, actually the first patients that came through Johnson County came through our emergency department. So obviously they came in unannounced, and it was when this was all very brand new. We subsequently sent all staff that had any interaction with those patients home, including a physician, until they went through the incubation period and they tested negative and were following the CDC and the IDPH guidelines to come back to work. So early on, that was a major concern. Now, generally, folks are reaching out and contacting their providers in advance, letting them know they're coming in for testing. But no, it's not a routine issue. It can always happen, and we always have to be prepared. And we're taking every precaution and utilizing PPE for those patients, which is why it's very important that we don't have a rush of patients that are healthy coming in for testing, especially if we increase their anxiety, because if they come in, we're going to take every precaution to protect our staff and to protect them. But then that uses up very, very valuable resources. So the short answer to your question is it has not been a dramatic concern where folks have been just showing up unannounced. But if they do, we have procedures in place as well as protective equipment to make sure that we keep them and our staff safe.
Can you give an update on your hospital's supply of PPE as well as what the handmade type of donations coming in,
Sure.
what that supply looks like, and if you guys have gotten the chance to inspect them and be like, yep, these are what we wanted, these are good?
Sure. Well, first of all, and a member of our team had I brought up the notion, I heard it mentioned to Dr. Jackson, of utilizing 3D printing. And so we are exploring that aggressively to see what opportunities that may present. As I mentioned earlier, we have over 700 masks that have been created by our staff. In some cases, we've had some of our physicians say they almost prefer the ones that are being made. They're very durable. A lot of them are made of more for a construction site, so they're obviously not only durable, but they're also cleanable. And so that's an opportunity. We've had literally hundreds of individuals reach out to us to offer to make surgical masks, other type of PPE equipment. We are coordinating to make sure we're doing that in a safe manner. And the way we would utilize that is also something we're looking at very closely. It's not the first thing we would go to for a physician, for a staff member per se. But for example, when somebody shows up at an organization, they have a potential of being COVID-19 positive. Them having a mask on themselves goes a long way to help slow the spread. So there are creative ways we anticipate being able to use some of that, but we would absolutely inspect it. We've had an incident command in place now for 18 days, meets every morning, has at least 3 or 4 follow-up meetings throughout the day. There's a whole group of individuals that are focused on making sure that everything we do, one, that we're coordinating with the CDC and IDPH, but also with our providers that know best to make sure we're not utilizing equipment that we don't feel is safe. So the shorter answer is we are absolutely going to make sure that anything we have or utilize is safe and meets standards.
Thank you.
Thank you.
Hillary again from the Press Citizen. Could you talk more about the why Mercy is opening up this influenza-like clinic? Where did this come out of, a need or to try to monitor how many people do have fever-like symptoms in general that might not be able to get tested?
It's a way to, one, respond to community needs so that individuals can come through in a protected way and to expedite their ability to be tested if there's concern, and do it in a way that's organized and safe both for our staff as well as for the individual. So that's where that need came from. The inpatient side that I mentioned, being able to expand initially to 26 private rooms for a COVID-19 dedicated unit up to over 50 is for those patients that are obviously sicker and need to be admitted. And so it's both on the outpatient side that we're wanting to make sure that we can test and treat individuals safely, also keep them a proper social distance from one another and from staff. But on the inpatient side, we absolutely want to be prepared for this potential surge. And it's created, all of our organizations in Johnson County, and I would assume Lynn County, and I know throughout the state, that it's been an ironic challenge for us because we have all limited our operations to about 50% of what is normal. In some cases, about 35, 40%. But at the same time, we've been spending a great deal of resources in planning for this potential surge. So I think from an outpatient side, whether it's the ILI clinic or whether it's on the inpatient side, if folks need to be hospitalized, we feel that we're taking all the appropriate steps to be prepared. Did I answer your question?
Hi, I'm Sarah with the Daily Iowan. I'm wondering if you have any kind of way to quantify how much more PPE you're using now than you may have before the outbreak.
Right. So the phrase that everyone utilizes in healthcare is the burn rate and how quickly we're going through it. So the only, we try to come up with daily with how long will our current supplies last. And the unknown variable is how quickly are people coming through to be tested. Right now, nationwide, the most recent number I'd seen is about 90% of those being tested are negative for COVID-19. So what that means is, yes, there's a sense of peace and relief for them as individuals, but if they are not symptomatic, if they don't need to be tested, at this point in time, we're encouraging folks to wait so we can conserve that PPE, in particular for the next couple weeks, while we wait to see what is going to happen with this potential surge. As Dr. Jackson mentioned, earlier, it's going to be different in different states. It's going to be different in different communities due to population density and other factors. So we want to be prepared for that worst case scenario. So the short answer is I can't really tell you how many days or how many weeks we could go on our current PPE. I will say there's been tremendous coordination in Johnson County with Johnson County Emergency Management, Public Health, great relationships with the UIHC and the VA. So I feel very comfortable as a healthcare community that there's going to be a lot of coordination both in Johnson County, but frankly throughout the state, that if we have a run and if there's a strong need, that folks will come together. Please.
Hi, Michaela from the Gazette. You said at this point it's important to conserve the supplies and testing supplies that you guys do have on hand. But I wondered if you could address the other end of that. If not everyone is being tested, does that mean we're not getting an accurate picture of the spread? And is that in turn a challenge then for hospitals not being able to kind of prepare if there is a surge?
Yeah, from a public health perspective, if you look at like what happened in South Korea, where they did ample testing early and very frequent, and they got a lot of people through quickly. They were able to then isolate individuals that were symptomatic and help control the spread. They really did it in a very impressive way for a large country. So I would say, in our case, from a hospital perspective, our concern right now is when you're presenting yourself to one of our clinics, to the emergency room, or to the inpatient side, that we're prepared to care for you. From a public health perspective, I think every effort is being made and needs to continue to be made to make testing more available, to make the supplies more available. There's been a lot of loosening of what needs to be in place in order to provide that. We're hoping to be able to offer in-house testing very shortly. And so there's a lot of things that need to happen, I believe, from a public health perspective, so that end number of those being tested goes up, and so that we're isolating those individuals that need to be protected. But I think back to Dr. Jackson's earlier point was, I thought, a good one. If you're somebody that has an underlying health condition, if you're in an age category that is vulnerable, then you should just make the assumption, and that kind of self-isolation should happen immediately, and so that you're protecting yourself. And I think for the rest of us, practicing social distancing, washing our hands or using hand sanitizer, staying home if you're sick, those types of things are very, very appropriate.
I think last week sorry, Hillary again from the Press Citizen. I think last week you said that you had tested 66 people.
Correct.
12 were positive. Do you have an update on that?
Yeah, it's now up to 89 that we've tested, and it's still the positive number is still at 13 currently, but most of those individuals were tested and then went home. They're not in our hospital. Okay, thank you very much.
Next up, we have Matt Degner, Assistant Superintendent for the Iowa City Community School District.
Good afternoon. Thank you for allowing me the opportunity to speak with you today. The Iowa City Community School District has been very active and taken some important steps the last couple of weeks since the announcement of school closure through April 12th. On Monday, we kicked off our meal distribution program at 6 different locations: City High School, Northwest Junior High, North Central Junior High, Twain Elementary, Wood Elementary, and Hills Elementary, along with some mobile deliveries to other sites. Meals are available daily, free of charge, and for children's ages 1 through 18. Yesterday, the district served close to 1,000 meals, and we're hopeful that number continues to grow in the days ahead. On Monday and Tuesday, families were allowed to come to school to pick up medication, and we provided information on how to continue to access mental health services for our students. Additionally, we've taken steps to ensure that our employees are paid and remain financially secure during the closure. The district has authorized a pandemic pay rate for those employees identified as carrying out critical tasks during the closure. The Board of Education passed this resolution at their meeting last evening. The district remains committed to continuing learning during this period away from school and has shared an extensive list of resources that students and families can access to continue learning while at home. Teachers are reaching out and connecting with their students, as well as providing them with additional resources that can be used as desired. We're also focused on all students and families having access to these resources and have been actively collecting information from families that need devices and Wi-Fi access. The distribution of those devices and access points will be happening soon. During this time, we encourage our community, families, and staff to stay safe and stay at home as much as possible. We miss you, we care about you, and are thinking about you. I'll take any questions you might have.
Travis with KWWL. Could you clarify, did you say that there is a different rate of pay for only essential employees in the district?
Yeah, we've tried to determine what essential tasks have to continue or critical tasks, and if employees are working during this closure, then yes, they're going to be paid their current rate plus an additional pandemic pay rate during that time of employment.
Have you guys had to make a decision? Like I see you saying essential people get a pandemic pay as well. Is there anybody that you've had to say we can't afford to, and I'm asking this because I know this has happened in other districts where they can't afford to pay everybody during the closure. Have you had to tell anybody we don't need you right now, we can't pay you right now? Has that happened?
I would say our decision hasn't necessarily been a financial one in that consideration. I think it's been what's in the interest of continuing to try to carry out those essential functions and those tasks that need to continue. So when we have meal distributions, those folks need to be on site. When we have some projects or some physical plant building checks and cleaning that needs to continue, our physical plant has continued to work during those times. And so that's really how we've tried to handle it rather than any kind of financial pressure. It's more what are the things that just have to continue while school's closed. But we really are trying to operate under school's closed during this time. We're trying to get resources to our students and trying to focus on the things that we can do away from campus at this point. But some of those things just have to happen. We have to feed students, and we should be feeding students. We're excited about the numbers we've had there. And then also just trying to continue to clean our buildings while we've been away.
When you talk about like the people who are staffing like the meal drop-off points, who are the staff that are working there?
Sure. So it's our food service employees, and we've had some of our physical plant staff also help with just kind of crowd flow through those sites to make sure there was appropriate signage and that people could traffic through the sites appropriately. And then we've had administrators that have also been on site during those days.
You may have answered it, but I don't know if I quite understood. So, like, is there a teacher right now who's at home and not receiving any pay during the closure?
No, all of our teachers are paid during that time. Yep.
Thank you.
Yep. Thank you.
Now we have Ken Crawford. He is Superintendent of Lone Tree Community School District and Highland.
Hi, everybody. Thanks for having me over here today. I appreciate that. at Highland and at Lone Tree, I'm very, very proud, and I want to make sure we also say, too, that the work that people are doing is fantastic, and that can be from educators, the custodial staff, to the secretaries. Everybody's working. This is not a time when people are out there just hanging out. We have a lot of people doing a lot of work, and that's for the students of the community, as well as for just making sure everybody in our community is getting the services they need. I'll start with the food. We have multiple people volunteering at Highland to make sure that we get the meal put together, getting out to the students on Monday and Wednesdays. And at Lone Tree, I've been super thrilled that our food director person said, nope, I'll just do it myself. So she's putting in multiple hours of time to make sure that everything gets done for the students of the community. So we've been great there. Our cleaning staff's been in, and they're doing a great job of getting everything done. It took about 5 days at Lone Tree, and at Highland it took about 3-4 days to get through 2 buildings. So everybody has stepped up and done a great job. Educationally, both elementaries are doing Seesaw and Class Dojo, and at the high school, both buildings are doing Google Classroom. And they're putting out a lot of educational services or opportunities for kids, and it is going great. The response back and forth has been fantastic, and we're also trying to track people that aren't online and reaching out to them and calling them to make sure that everything's okay. Special ed departments reached out to all the parents and talked to them, making sure everything's okay. So the outreach that I don't think sometimes gets a lot of press is that teachers are not just sitting at home. They're doing a lot of work, and it's all for the communities and for the students. We reached out to all the daycares to make sure, are you full? Are you getting a lot of phone calls? What do we need to do to help in that area? So I feel like sometimes we get lost in that we're having 4 weeks off and it's vacation, and it is not. It is not. There's a lot of people doing a lot of work for their community. So I want to thank them and make sure that that gets emphasized here today. Any other questions? I know that there's probably a couple, but maybe I've covered everything too.
Travis with KWWL. We've done some reporting about how the way that the Iowa laws kind of stack right now. It's hard to make online classes required or count in some cases. Have you received any guidance from like the state Department of Education or anything like that, or are you under the impression that you guys are just offering these like on a voluntary basis?
The key phrase is educational opportunities. We cannot require, we cannot grade, we don't send out rubrics on any of those things. The guidance from the Department of Ed is that we do not have that ability to do online grading. And so we're given those opportunities, and parents and kids can take advantage of it if they want. If they don't want to, then they don't have to. So we're just trying to give as much out there so we don't have that, it's called kind of that summer slip when they're gone and off school for 10, 14 weeks. We just want to give those opportunities. And the feedback we've been getting from parents has been fantastic, that they are trying to get the kids doing stuff and having a little bit of fun at it too. So it's been a huge positive, I think, in both communities. All right. Thanks, everybody. Appreciate it.
And finally, we have Dave Wilson, Director of Johnson County Emergency Management.
Good afternoon, everyone. Thanks for coming out. I'm going to make my comments brief today. I think you heard a lot from the hospital leadership and the school districts and the cities as well. I think it's really important to remember that this is a unified response, and it's been a unified response since it started that Sunday night. We continue to enjoy strong partnerships not only locally, but as well with Lynn County and Emergency Management, Public Health, and the hospitals in Cedar Rapids. So to that end, we continue to push out supplies, personal protective equipment, have businesses and industry stepping up to the plate. Most recently, we've got a manufacturer here locally that was going to produce face shields and just needed somebody to cover the raw cost of material. He stepped up to the plate today, reached out to us and said, I can produce these if somebody can pay for the raw material. That's the type of things we see from Iowans, especially folks here in Johnson County. And we think those strong partnerships and collaborations have developed over the years because we are so used to doing disaster response, and we're so good at doing recovery around here. And those positive messages and those messages of calm and what we can all do to work together to minimize the impacts of COVID-19 are really what we want everybody to take home. Social distancing, all those things that really we've been preaching since day one are important to mention. So for the news media locally, I'd like to say thank you. The message you guys have carried forward is one of calm and reassurance, and that is important because it's not necessarily the same narrative that you see everywhere else. With that, I'd entertain any questions. Travis, you're usually first.
I'm still thinking.
Okay. Hillary, you're usually second. Yes, ma'am.
Sarah with the Daily Iowan.
Sarah.
I'm wondering which manufacturer said that they were going to.
You know, I don't know that he wants me releasing his name, to be honest with you. I don't, that's embargoed information. I don't know what he necessarily wants overrun, but they reached out last couple days actually, and their product looks pretty good. And so we've got some facilities here in the healthcare industry that are going to provide the money for the raw materials for them to produce that. But it's kind of like I go back to joking about when something shows up in a store, if we say that, it winds up a stampede. I don't necessarily want to release that without their permission.
Just a quick follow-up. You had called for donations for PPE
Yes.
as well. How much have you gotten? Like, what are the channels if people want to donate those?
Yeah.
Should they go through you?
Yep, they should. If they want to contribute them, donate them here to the Johnson County Emergency Operations Center. Our logistics desk, that phone number is 319-356-6707. And if the phone line's busy, just leave a message. And then we've got an email as well, so if they need that, they can contact us through our email. We've seen a steady stream every day since we put that out last Tuesday, I believe it was. And we've seen a steady stream of donations. Iowa City School District just approached me a little while ago in the EOC, said they're going to be dropping off some additional face shields that they'd reacquired, repurposed from different school district buildings that obviously aren't using them right now. So we've seen a good response from, healthcare partnerships that are closed, whether those are, dentist practices or whatever, to business and industry. ITC reached out to us, et cetera. It's just been across the board. And it's typical what we've seen here in Iowa, whether it's a tornado or flood or whatever. It's common that we see people step up to the plate. And I expected no less as soon as we put that out. It's been a daily drive. And then those get we sign them in, track who it was that donated it, and then we reissue it out so it sits on the floor less than 24 hours. Does that answer your question adequately? Okay, thanks.
Travis with KWWL. We've talked about how the decision for a shelter in place for the county is one that's being discussed. Can you say if any emergency management crews have done any kind of preparations, or if you've done any, possible outreach to businesses or something saying, be prepared?
No. So this is in development, and it's going to be developed in collaboration with Iowa Department of Public Health, the Iowa Governor's Office, the local hospitals, local elected leaders, and folks in Cedar Rapids, because we've got a very transient corridor. When that comes out, if that comes out, let me back that up. If that comes out, and if we get to that threshold, it will be communicated. It will not be a surprise. But we need to do that and drive that based on quantifiable things that are unique and specific to Iowa. Hillary.
Hi. So regarding the shelter-in-place order, a lot of the concern that we've heard is that it would interrupt the supply chain for
Sure.
local hospitals and their staff and the equipment that they use. Has emergency management looked at how other cities have successfully done this shelter-in-place order for models of how to do that and how to not interrupt?
We've
the
looked
supply
at
chain
that.
and staff?
We've looked at the challenges, and there's numerous challenges to doing that. The reality is that in Iowa, that type of thing is a misdemeanor offense. It's very hard to enforce, and we've looked at those types of things. We're Iowans. It's much easier to get compliance by asking people to do things than it is by telling them to do things. And that's the reality that we've seen through every disaster we've had throughout Iowa. If we ask our neighbors and we exert a little social pressure, that's gotten a lot farther with the honey than it ever has with the stick. So we've really tried to push back on, social compliance, social responsibility, and things like that. But we've looked at those things. Those discussions continue, but we're not there yet. Other questions? KCRG, come on. All right. Guys? Mitch? All right. Last shot? All right. Thanks, everybody, for coming out. I really appreciate it.